Hello, everyone. Thank you for joining us today on World Hearing Day 2021. My name is Gordiana Mosher, and I'm the Canadian Hard of Hearing Association Manager for Accessibility Projects and Communications. We have a great turnout today for our webinar. There will be an opportunity for you to ask questions for our guests or something you'd like to share. We encourage you to do so. This is an important conversation for all of us on World Hearing Day. Please use the chat functionality on the Zoom platform, which many of you have already. Our moderator will address all the questions at the end of when our speakers are finished presenting. And if you are on social media, please let us know where you are from and where you were watching us from this morning. Post your photo and tag CHHA National on our social media platform. So let's get started. I have the pleasure of introducing the Canadian Hard of Hearing Association Board Chair, Marilyn Kingdom. Welcome, Marilyn.
Thank you, Gordiana, for that introduction, and welcome everyone to World Hearing Day 2021, whose theme is Hearing Care for All. And this day marks the launch of the World Health Organization's World Report on Hearing, which presents a global call for action to address hearing loss and ear diseases for everyone. This call to action complements the activities of the Canadian Hard of Hearing Association in a great way. As we call ourselves, CHHA, is composed of networks from coast to coast who share the mission of connecting Canadians impacted by hearing loss through advocacy, education, and community engagement. Our role is to work with policymakers and legislators to ensure all those impacted by hearing loss face a barrier-free environment. An example of CHHA's advocacy work is being involved with the federal government when they initiated a series of national federal accessibility consultations across Canada. People living with a variety of disabilities face barriers to being able to fully integrate into society. And the federal accessibility legislation was their opportunity to advise government on what needs to be done to improve their lives. CHHA members were very much involved in these consultations. CHHA was also awarded funding to conduct public consultations with its stakeholders to contribute to this new legislation. CHHA partnered with 20 national organizations to expand the reach of these consultations. And the focus of this project was on invisible disabilities and resulted in the CHHA Spotlight on Invisible Disabilities project, which is available on the CHHA National website for any of you who would like to read the report. A further result, and this I am really excited about, was that CHHA, together with other organizations, was instrumental in the development of Bill C-81, which many of you may have heard of, the Accessible Canada Act. And this is to benefit all Canadians, particularly those with disabilities, in creating a barrier-free Canada. This was a significant achievement. The cost of hearing aids continues to be a financial burden for many, so there was a need to establish legislative policy changes that shift care from the sole focus on hearing aids to a focus on a holistic approach to treating the person and their hearing loss. CHHA advocates again for greater transparency in the price of hearing aids and a comparison between technology offered by the various manufacturers, which are limited in Canada at this present time. This is beneficial to consumers and clinicians because better informed clients can choose a product that best meets their lifestyle and lead to a fully inclusive life. Education is another area that is very important, and CHHA has an advocacy role in increasing public awareness and education regarding hearing loss. As many of you in Canada know, May is Hearing Awareness Month, so events are held to increase CHHA's educational impact and community engagement. A conference is held every 2 years to bring together experts and workshops provided on hearing loss issues. CHHA networks, which I am proud to say, also provide webinars on speech reading, introductory American Sign Language classes, and educational workshops for those experiencing hearing loss. Since attending the webinar on World Hearing Day in January of this year, CHHA has initiated a social enterprise with the development of an e-store for hearing assistance devices. New devices are being added to the e-store all the time, a mentoring program, and is continuing a partnership with an organization to provide clear face masks. More details regarding the mentoring program, which is very important and which I'm very proud that CHHA offers, will be provided later in this webinar. And to complete this important work, the right team is essential. And that brings me to introduce the moderator for today, Mr. Lee Peugeot. Lee Peugeot is CHHA's new National Executive Director for the Canadian Hard of Hearing Association. And Lee looks forward to being a part of a transformation that will bring the association to the next level and make a positive difference for Canadians living with hearing loss. Lee has a vast philanthropic experience and an entrepreneurial background through his consulting firm working with small grassroots organizations and large multinational charities serving people with disabilities. Lee is the contributing author to the book, The Vigilant Fundraiser, and he has been a keynote speaker at various Canadian and international conferences, speaking on strategic planning, volunteer management motivation, board and staff relations, fundraising, and goal setting. So it is my great pleasure to turn this over to Lee. Welcome, Lee.
Thank you, Marilyn. And good morning to everyone on the West Coast and the Prairies, and good afternoon to our Eastern and Atlantic members. So welcome everyone to the Canadian Hard of Hearing's webinar on World Hearing Day. The theme of World Hearing Day 2021 is Hearing for All, Screen, Rehabilitate, and Communicate. It also marks the launch of the first World Report on Hearing from the World Health Organization, a seminal document that aims to drive policy actions for the integration of ear and hearing care into national health policies. So we have a wonderful response today. We had 83 people say they wanted to come today, and that's great. One of the largest webinars we've ever had, but it's only the first for this year. We have more on Friday and Saturday and throughout the year to celebrate the launch of the World Hearing Report. It's also my honor to bring greetings from our Minister of Health, Patty Hajdu. She wishes us the best for all of our efforts today and throughout the session, but she wasn't able to come today. And in return, we promise to keep in touch with all of our provincial and federal MPs and to keep our projects and outcomes on their radar throughout the year. I wanted to also thank our Hard of Hearing networks for their support, reaching out to their provincial health ministers to bring awareness about the webinar today, and for the efforts of everyone to make World Hearing Day a success. As mentioned earlier on, the Canadian Hard of Hearing Association is the leading consumer advocacy organization representing the needs of nearly 4 million Canadians impacted by hearing loss. We work cooperatively with professionals, service providers, and government agencies to provide life-enhancing support and advocacy. We ensure people with hearing loss can overcome any communication barriers in any aspect of their lives. Today is indeed a celebration, globally and across our country, as we recognize World Hearing Day. It's an annual event and the largest awareness campaign in the world for hearing. We are calling on action on governments and healthcare organizations to address hearing loss and health-related issues. This webinar will be the start of a year-long advocacy campaign related to the World Report on Hearing, and the program will be centered on raising awareness about hearing loss, the importance of hearing screening at all ages, and the need for necessary supports following an identification of hearing loss, something CHHA is doing throughout our newly launched mentorship program. Even in a developed country like Canada, hearing loss often goes unaddressed, whether it's through stigma or through the difficulty of connecting with a hearing professional. And it's not also just being addressed because of the high cost of hearing aids or the complications around cochlear implants, but we want to help people through self-help and communication strategies and peer supports at all levels of technology and all levels of social interaction. Together, we can help improve the quality of life for every individual with hearing loss and enhance their contribution to society. Our campaign will also highlight existing resources and supports, such as our peer mentoring program, and provide support to individuals doing their challenging time of adapting to life with a hearing loss. Because good hearing and communication are important at all stages of life, communication can be key to our social interactions, educational pursuits, employment potential, and our overall well-being. And we'll be addressing each of these throughout the year. Hearing loss and related ear diseases can be avoided or prevented through actions such as protection against loud sounds, good ear care practices, and immunization. Hearing loss and related ear diseases can be addressed when they're identified in a timely manner and appropriate care is sought. So people who are at risk of hearing loss should check their hearing regularly. People who have hearing loss should seek health care from a registered healthcare provider. So we have a great lineup of speakers today, and we encourage you to ask questions by posting them in the Zoom chat room. We will be addressing all of the questions at the end of the session, not at the end of each speaker session. So if you've asked a question, we'll wait till closer to 1 o'clock before we'll answer them. So we'll be monitoring all the questions, and as we get started, I just wanted to introduce our first presenter, Dr. Ruth Warwick. Ruth is a founding member and former national president of the Canadian Hard of Hearing Association, and she's currently the president of the Canadian Hard of Hearing Association's British Columbia chapter. Dr. Warwick is also the president of the International Federation of Hard of Hearing People and first vice president of the International Disability Alliance. She's been actively involved in the World Hearing Forum of World Hearing Organization and is serving as co-chair of the working group to promote this World Report and World Hearing Day. Ruth lives in Vancouver, so welcome, Dr. Warwick.
Thank you very much, Lee, and thank you to everyone for being here today. It's my great pleasure to participate in this panel because it is an exceptional day. We have been waiting for a few years now for the World Report on Hearing, and it is here today. It is being released today on World Hearing Day. And as Lee mentioned, this is a seminal report that is going to change the lives of people with disabilities. It promises to be a report that does not sit on anyone's shelf. And there are several reasons for that. First of all, it's a report that talks about hearing healthcare in a holistic way, and it deals with healthcare issues in a way that encompasses accessibility, mentoring services, our well-being, and peer support, all of the aspects that are important for a person's health and well-being. Secondly, this report was mandated by the World Health Assembly. So all of the provincial and federal ministers of health have brought into this particular report being developed. And they will have a stake in ensuring that the recommendations are implemented. And then finally, there is a huge community of people who are going to make sure that the advocacy to implement the recommendations continues. There is already a volume of people that have been involved in the report, and they are continuing to network together through an organization called the World Hearing Forum that was established under the leadership of WHO. And in addition, through the International Federation of Hard of Hearing People, of which I'm president, we are committed to ensuring that advocacy takes place on this issue and that we involve our member organizations that consist of organizations from countries such as CHHA in Canada. Now, I have a few slides that I want to show you just to highlight some aspects from the report. First of all, is the not too astounding finding that most people who have a hearing loss do not have access to interventions. And what is interesting in the slide that is being shown here is that we're not just talking about people from low and middle income countries. We're talking about people from high income countries, which is the bar on the right. This gray bar shows that almost 75% of people in developing countries do not have access to hearing aids as one tracer of a lack of access to intervention. That is a woefully inadequate figure, and we need to really be alarmed about this figure. Next slide, please. The message of the report is that there is something that we can do to change things through public action, through our healthcare system, and through our individual advocacy and working through our organizations. And the report is framed in 3 areas. First is prevention, second is early identification, and third relates to appropriate care. And I'm going to, in the next slide, focus on early identification as one of the areas. Could we have the next slide, please? So under early identification, in many countries of the world, they don't even have newborn hearing screening programs. Now in Canada, we're very fortunate that many provinces do have an excellent newborn screening program. But what are we lacking? We do not have regular hearing screening for older adults. It is lacking in most jurisdictions. And this is the age group that is by and large getting a hearing loss. And so it's important for us to have screening mechanisms built into our healthcare system. And I can say that on behalf of the Canadian Hard of Hearing Association in British Columbia, this is one of our priority advocacy issues. And we look forward to working with CHHA National on it. The next slide, please. I would just like to also summarize that the report is focusing on integrated people-centered ear and hearing care under a framework called hearing. And you will see on the slide on the right that hearing refers to hearing screening and intervention, ear and disease prevention and management, access to technologies such as assistive listening system, rehabilitation services, improved communication, which includes captioning, noise reduction. Far too many people are still losing their hearing as a result of noise, either in the workplace or the environment. And greater community. We cannot do it without acting together. And it is very pleasing that in the report, we will see that our issues of captioning, our issues of rehabilitative therapy, assistive technology, hearing aids, peer support programs, sign language access are all included as part of making this a holistic approach. And as I said earlier, I believe that this report will not sit on a shelf. And it is up to us, though, to make sure that that does not happen. We need to advocate with our governments, with our policymakers, to make the recommendations of the report reality. And we can use this report as an important advocacy tool. It is an extremely evidence-based, powerful tool. And in closing, on the next slide, I would like to invite you to join the Facebook that has been set up for the Hearathon 2021. And we will actually be posting some information about this event on that Hearathon. And there's another workshop, as Lee will mention later, there's one on Friday, but on Saturday, CHHA Vancouver and BC are having a workshop on the future implications of the World Report at 10:30 Pacific time. And to sign up, just go to chhavancouver@gmail.com. Look forward to chatting with you further today and on Saturday. Thank you.
Thank you, Ruth. I really appreciate all the information that was sent. Just those few slides really do show the need for World Hearing Day and for the report. Know that Ruth and Dr. Marilyn Dahl have spearheaded the Canadian Hard of Hearing BC's mentoring program, and we've been able to launch that program across Canada, which is going to help with some of that peer support after the identification. But the need for integrated and natural services throughout all of our lifespan towards hearing is something that really needs to be pushed. Because during the pandemic, I think that the pandemic has heightened the communication barriers that a lot of people with hard of hearing have faced. While it's become the norm to see ASL interpreters and closed captionings on more things, the use of face masks, the inability to speak clearly through clear plastic barriers, and just how so many people have now realized that they might be getting a hearing loss because of these very small interventions, I think really should spur people on to get a diagnosis and speak to an audiologist and get tested appropriately as a really important first step. So our next presenter is Bowen Tang, and who's going to share his perspective on initiatives with youth from around the world through the Canadian perspective. Bowen is a teacher for the deaf and hard of hearing, and he's co-founder of the Canadian Hard of Hearing Association's BC Youth Peer Support Program. And he's also president of the International Federation of Hard of Hearing Young People. Bowen?
Thank you very much, Lee, for that introduction. Welcome, everyone. It is a pleasure to be with all of you here today to celebrate World Hearing Day. My role here today is to represent, also to share the perspective of young hard of hearing Canadians, as well as young people from around the world. I see that we have some young participants here in our webinar, and it's fantastic to have them here to witness the impact of hearing loss on young people. First of all, some of the things that I will share will also relate to anyone across all ages. So I'm just sharing from my own personal experiences as a young person. And the two key points I wanted to make from the World Report on Hearing is access to technology. So as a young person, we have so many things to think about. Ultimately, what our future will be like, what our careers will be, where we're going to live. And with that, there's so many expenses that we wanted to consider, such as tuition for our education and rental, car payments, or perhaps even mortgage. But on top of that, for young hard of hearing people, the one additional thing we have to consider is hearing aid costs, as well as cochlear implants. These are the extra costs that we have to put into our budget consideration, and that really takes a toll on our ability to manage everything at the same time. Which is why in the World Report on Hearing, it highlights the need for hearing assistive technology to be classified as essential products, so that the burden is not on us as a consumer to acquire these necessary technology in order for us to be participating in our communities. So that's one really important key point to advocate to our policymakers, that government should really put an investment on providing hearing aids, cochlear implants, and any other technology that will support us in our education and our workplaces. That will also include captioning services and sign language interpreters. The next thing I wanted to point out is that a lot of the times people think that rehabilitation services simply mean we go to an audiologist, a hearing healthcare professional, get our hearing aids fitted, our hearing tested and screened, and that is it. That is completely finished when we receive our hearing aids and cochlear implants. But what they are forgetting is that hard of hearing organizations like Canadian Hard of Hearing Association is an equally essential part of the rehabilitation process. Because the hearing healthcare professional, they provide the professional knowledge about how to manage the hearing loss, but they don't have that shared experiences as us, the people who live our lives with hearing loss. So it's important that we also have an equal attention on resources provided by the Canadian Hard of Hearing Association or any other hearing loss-based associations across Canada. So that for anyone who has an identified hearing loss, they may have the opportunity to have conversations with those who know what they're going through, who can relate to what they're going through, to find that sense of belonging in the community. Because It can be so easy to feel isolated when we often live in communities where we're the only one with a hearing loss among our families, friends, and workplaces. So we need to have that safe harbor where, we can truly feel comfortable being ourselves. We know that we can be in a space where we will not be judged for who we are and for the challenges that we experience. In the past conferences that I've attended at the CHHA conferences and many other events for people with hearing loss, particularly for young people, I've seen the power of how much an impact it makes for a person to meet someone who knows exactly what they're going through and how it was really life-changing for them, myself included. When I first came to Canada in 1998, I was the only one with a hearing loss in my school. And then I came across the Canadian Hard of Hearing Association, and I met some of my lifelong friends there, and we still remain in touch today. So really, our policymakers should understand the significance of hard of hearing organization to provide that emotional and social support that is very significant in addition to learning how to communicate. And lastly, I would like to share that the International Federation of Hard of Hearing Young People makes the pledge to support the rehabilitation journey for young people with hearing loss. And I look forward to meeting all of you out there so that we can be together to advocate for equitable access to ear and hearing care for everyone. Thank you very much.
Great, thank you, Bowen. That provided us with a lot of really good insights. I think a lot of people who have hard of hearing and who've tuned into this webinar probably remember all of the things you're talking about, trying to find a mortgage, pay off student loans, but having, the expenses around hearing aids, which a lot of people still associate with older individuals, does show that there may be a real need for the peer mentorship program, for the young adult network that we have at CHHA and all the great work they're doing, and also, of course, any of the virtual webinars that we're able to provide and peer support. So thank you very much. And we're really glad that there is a group of individuals, professionals, and people with hearing loss who are just starting their adult journey, who are going to lead and be champions for the World Hearing Day and for all the organizations you're involved with. So thank you. And one of the great pleasures I have is to be able to introduce our next speaker. Chris is also a young person. And if you ask Chris Martin to do something for you, his standard response is not a problem. Stepping into a car that reaches 200 miles an hour, no problem. Speaking to 300 students who look to him as a role model, no problem. Being born profoundly deaf, not a problem. In fact, Chris says that being born with a hearing loss may have helped him in his racing career. He's learned to race primarily using his tactile senses, to feel the track, to feel the engine and the steering, and it's given him a great ability and use his instincts that help him above other people who just use their sight. Now, with all of the many trophies Chris has collected and looking to take he's looking to take himself through the next level. He's been offered a full ride for the Touring Car Championship seat, and he's using an esports sim racer. So he's actually a video game character, which is really cool. Can't really do too much tactile sense on that, but he says he's also good at Mario Kart. Chris speaks all over North America, and his speeches give hope to children and to parents to inspire them to defy any odds placed against them. He said many exciting moments, including being featured on the Discovery Channel's show Daily Planet, and he was top 3 in the NASCAR Hub show. So let's ask him if he's ready to address this crowd. Chris, are you ready?
Yes, thank you, Yi. It was a pleasure being here today in the Spirit Center all around rules about watching today. So I'm really looking forward to talk about my experience. And so starting when I was born deaf, and my mom was found out about when I was 12 months old. And I started wearing hearing aids. It was difficult because hearing is give me much hearings. So I started going to speech lessons when I was about 14 months. My teacher, Mrs. Crawford, CHHA Hospital. At the end of each lesson with Mrs. Crawford and my mom, or if I was good speech lesson, I was get a toy, usually something with the wheels. Of course, I'm going to curse. So after 7 years with the hearing aids, it was a tough to go. So my parents found out about cochlear implant program in London University in hospital. It was the best day I ever had qualified for my life. So now I have to go to speech lesson with my mom and Mrs. Bernstein from Boys, hearing deaf children. So she was speech therapy for all the deaf kids. So after going my life going to school, I just go regular school, public school, and I was the only person deaf or hard of hearing in the classroom. So I was going very difficult time in the classroom, couldn't hear the teacher. So someone helped me. It's come from phone hearing system in Canada. So I started wearing FM system and hoping to hear a teacher when the teacher is talking in the classroom. So it was very helpful. And started racing. I grew up racing family. My grandfather and my uncle are the racer for years. So I started watching them when I was a kid. And I thought myself, I love it. I want to do something because I love engine. I can hear sound, smell. So I told my parents that I really want to do a racer, just like my grandfather. So my parents gave me an idea. If I was doing well in school, keep them up, and then I can go racing on the weekend. So when I was 12, and I got my first go-kart on Christmas Day in 1997. So I'm super pumped when I start racing. So people wonder how I can communicate during racing my career. After many years of championship in go-karting, so it's time for me to move up to stock car racing, which is NASCAR, open wheel, and tuning car championship. And so Pierre from Bona Hearing System in Canada helped me how to communicate and connect my racing helmet and with the FM system. And so I can communicate with the spotter and the cruise shape. So that's how I communicate and allows me to go racing at the racetrack. And then after racing, when I'm not racing off track, and I decided to work with public speaking around the world and going to the school board. And the reason why I want to be public speaking because I like to help kids. And my understanding, they're going a very difficult time, just like me. And I understand how life is difficult being hearing loss or born deaf. And how you get school, how you get help. And so I like to be a role model for them and help them understand how life's going through. No matter what, who you are, you can do whatever you want and don't listen to other people. What they tell you, no, you can't do it. So I told them I can do it wherever I want, and I proved that I can do it. I understand in school time, I have so much feelings that people making fun of me, how I speak, talk, and hearing aids. I'm not afraid of them. So I move on and I prove it. And so I'm still working on public speaking and carrying on. Thank you very much for watching.
Thank you, Chris. That was a really good story. I really appreciated it, and I did want to ask you about how you did race and communicate, but with the FM system, I really appreciated it. And it just reminded me of something that Bowen said, that both you and Bowen were the only people in your school who were experiencing hearing loss, and there were some things that teachers were able to do, and but you also talked about some of the social isolation. Bowen, can I start with you about talking about how you think that may have changed with some peer support and for kids now who are going through the school system? And then Chris, I'll get you to also talk about that. So Bowen?
Will you mind repeating the question, please?
You were the only person in your school, you mentioned, who had hearing loss. And have you think things have changed in the few years since you've been in school? I know you're a teacher yourself, but you teach for a group of students. So how do you think things have changed, and what can we do to improve the lives of students?
I definitely things have changed for the better in the last couple of years, particularly due to the social media and the technology, so that it is so much easier for children and families to connect with one another. The teachers of the deaf and hard of hearing are also quite well informed through their networks, so it's quite easier for hard of hearing children to connect with one another, where the teachers will bring them together in a social outing at a restaurant or have a bowling day, a games day. So it's definitely become more of a norm for us to bring together a community. Especially during this pandemic, where children in rural areas are now able to be included in all these connections, because in a regular year, they had to travel great distances just to meet someone from a nearby town. Like it could mean like 7 to 8 hour drive just to get to an event so they can meet other hard of hearing people. Now with the virtual platforms, it's just one click away for them to be able to have a conversation with someone. So I am definitely happy that things have changed so much for the better, and it's so much easier to connect, and there should be no barrier preventing children and families from connecting with other people with hearing loss. Mm-hmm.
Great, thanks, Bowen. And Chris, how has the world of racing changed in terms of communication? Do you find there's other people out there who come up to you and talk to you about their hearing loss?
Yes, and I was in racing one time in North Carolina, down south, and I saw up a racetrack, and I told the official of NASCAR, and they said, okay, they're not sure how we go on a racetrack, and communication is a video. So I said, well, I have FM system, and I could prove it. So they allowed me to go on a racetrack, so I go a couple laps, and pass a couple cars, and communication with my team. So they heard me on the video, and okay, that works. They're happy, they feel comfortable. So they allowed me to go a race. So I go racing for 100 laps, and I passed driver PKE, and stay out of trouble, no accidents. And so the race is over. I went to my pits, and most drivers, the band, the official came to me in my trailer. They would say, wow, you can drive a car, communicate on the radio. They're very impressed my skill driving, communicating. And they don't try to stop me. So, and actually, they were shocked at the first place before I went on the track. I was like, how they can hear the radio? So I'm very thankful, grateful for technology, just like Bowman said. Technology really help people with hearing loss.
Great. Thanks, Chris. I just wanted to let people know, you can ask questions of Chris or Bowen or Ruth in the chat session, and I'll be able to see them and ask the questions for you and direct any of your inquiries. But before we do that, Ruth, one question for you to get us started. Both Bowen and Chris and yourself were Canadians being able to be successful despite a hearing loss. But what does it mean for our government services and for other people who have hearing loss when even 75% of Canadians don't have access to the proper services. How do we connect with the government to make sure that all Canadians who need it have access to the proper healthcare services?
I think we need to advocate with our provincial governments. All the CHHA branches and chapters and individuals should join together with CHHA National in a campaign that brings this report to their attention and particularly highlights the priority areas for us. And it may differ from province to province. But there are way too many people out there who are not getting the services that they need because of when you're, I think Bowen, myself, and Chris, we grew up with being hard of hearing or deafened. But people who are getting a hearing loss in their 40s, 50s, 60s, their identity is being a hearing person. And now they have to shift to being hard of hearing or deafened. And it's a huge cultural shift. And they may not always have the support of family and friends, or even their workplace. They may fear they lose their job if they admit you have a hearing loss, because when you have the hearing loss, you don't know actually how much you're missing out. And often you don't even realize how many services and programs can help you, can really make a difference. And it can even be small things. And Lee, as you mentioned, with the mask thing, one of the things that I found is when I tell other people that I have a problem hearing people when they have a mask on because I can't read their lips. And these are hearing people that say to me, I have that problem too. And it could well be that they actually have a hearing loss that they're not fully aware of. So it's going to be a multifaceted approach. We have to do public awareness. We have to do our advocacy campaign. And we have to also convince governments that by and large, we're not talking about a lot of money. We're actually going to save a ton of money if we do this. We save in terms of healthcare cost, in terms of the economic losses, and in terms of what we lose from the community by this happening. So we actually save much in the long run. And a lot of the interventions don't really cost a lot of money. Hearing aids and cochlear implants cost a lot, for sure. But other interventions don't cost a lot at all. And I know that just the simple thing of being able to read a person's lips without that mask covering their face, I mean, that to me, it's changed, I think, how all of us have been feeling about being able to connect with other people. And if you could just give me that back, I would be quite happy.
Okay, thanks, Ruth. We've had a lot of questions come through, so I'm going to be asking the panelists try and combine a couple of the questions, to make sure that we can answer as many as we can for everyone, because some of them are quite related. So if you hear the question that you asked in a little bit different format, it's because you're asking questions that others have asked as well. So this question is to Bowen and Chris, but please, Ruth, chime in, but I'll ask you to talk a little in a minute. This person is a senior citizen, but they have severe and profound hearing loss. And they said they're often left out of family and social conversations because it's hard to hear people. They feel it's emotional strain to keep asking people to repeat themselves, even in one-on-one situations. So how do you guys handle that when you're in a social setting and it's hard to hear and you feel left out? So how do you deal with that? Chris, I'll get you to go first.
Being hearing loss and communication, I know it's very frustrating when people, like my work and meeting people in public, sometimes I'm misunderstanding and I don't mind to ask them to repeat. And I was telling them, and like, I'm hearing impaired, sometimes I don't understand you, and then okay, no problem, and respond, repeat again, just being honest and don't be shy to ask for help, and just try not to get frustrating, just take your time and work these out, and especially today, like wearing masks because it's COVID. And one time, like last week, I went for lunch, and I ask them what I want for lunch, and really all the time understand what they want to eat for lunch. So the only way I can talk to them is just in my phone, and I type it what I want for lunch, and I just show them equally, and they know what I want. So that's why I do closed caption and type title, show them, then I'm hearing impaired. Can you order this lunch for me? And and don't be shy if I ask for help.
Okay, great, Bowen.
Well, there can be so many different factors that can attribute to the challenges in understanding the person. For example, if we're in a noisy situation, it's of course naturally more difficult to hear that person one-on-one. So first and foremost, like I would look at what the technology options are, right? So I will have my hearing aid and cochlear implant on at all times, and if that's still doesn't give what I need, then I use other technologies such as the larger pen and other microphones to be able to get a better audio quality from the person that I'm communicating with. But ultimately, I find that the way to overcome communication challenges is to be honest, to really get out of the comfort zone, because I experienced that myself where, do I really want to cause an inconvenience to this conversation we're having by saying that I actually didn't understand a single word that you just said, and that person had to start over again, right? So there's a part of me where I would hesitate to speak out purely because I felt it was inconvenient. But really, we're doing both of us a disservice because I'm not getting anything and that person's not being listened to, so what's the point of the conversation that we're having? So what I have learned over the years is, yes, despite it being hard to admit that I did not hear it, I do have to be honest with myself and with that person and say, look, this is not working out for me. I tried the technology option. This is what's happening, and could we figure out a way that would work for the both of us? It might mean moving to a different environment. It might mean that we need to go to pen and paper format if it comes to that. But the thing is, we are able to understand each other and have that communication. And that is a way for us to be included, even though it may not be as fast as speaking to each other. So I would say it all comes down to being honest with yourself and just say, I'm sorry, I have a hearing loss. Let's try something to make this work. Mm-hmm.
Well, thank you both. I do really appreciate the fact, that it really does mean that there's a patience that's needed with technology as assistance, but open and honest communication. And I do both understand, since being Canadian, you both said, I'm sorry, I have a hearing loss. And that may be, something that is, easy for both of you. So I'm going to open up a little bit to Ruth, and actually, Marilyn, if you don't mind, I'm going to ask you as well. The person who asked, it wasn't a young adult who may not be as comfortable with technology, carry their iPhone around all the time. So Ruth and Marilyn, do you have any perspective on the little bit of the social isolation or the feeling of inconveniencing someone when you want to carry on a conversation?
Go first, Marilyn. It's up to you.
Thank you, Ruth. One thing I did want to do is just provide a little bit of a different perspective on this. For those of us who were born hearing and lost our hearing a little bit later in life, is that your family and your friends, and this is something that Ruth mentioned previously, is they recognize you as a hearing person. So when you lose your hearing later in life, all of a sudden it becomes an aspect of you're changing the dynamic of the family, you're changing the dynamic with your friends. So at that point, it really becomes, in my opinion, a joint effort for you to be able to communicate with them, but for them to be able to communicate with you. And there's all kinds of technologies for the hard of hearing person to use, but there's technology for your family and friends to use as well. So it really is a two-way communication. So over to you. Just wanted to give that perspective.
I think that all of the speakers have covered the important points. One is making it clear that you have a hearing loss and that you're not able to follow the conversation. And then other people will hopefully make more of an effort. I also make sure that I position myself when I go out with a couple of friends. I'm always in the middle so that I can hear the conversation from both sides. And you know what? We're never too old to learn to use technology. Technology is wonderful if it helps us. And I have used an assistive listening system in social situations, family situations. And it's about being clear to the other people. They do want to know they're not being recorded, though. So I usually make that clear. I think that it's a journey, and if the family member isn't receptive, you could always ask them and refer them to CHHA. And you yourself might want to take part in the mentoring program, because this is a huge change. So if you have a mentor, you can talk about these issues in more detail with that person and really get at some of the issues. We're just scratching the surface here. So a good plug for the mentoring program, but actually it is a great program. There's wonderful mentors that are available to help anyone who is dealing with a hearing loss.
Thanks, everyone. I really appreciate a lot of what you're saying. There's nuances going on, and the chat is also really busy. There's a lot of comments and questions around technology, and I don't think that today we're going to be able to answer what is the best program or application or what device is really good to use. But just to let you know that the Canadian Hard of Hearing Association will be sending out different reports and white papers on virtual platforms, on assisted listening devices, and other things that are going to help during the pandemic. It's part of our goal this year to really make it easy for people to use the virtual platforms and to provide advice on what might be the best accessible platform, whether it's communications, ease of accessibility, or even just the cost around what's going to work in a work or social situation. So thank you for that. Now we only have a few minutes left, and I'm just going to come through some of the questions. A lot of them do talk about advocating for yourself, and something very specific. But there is a question, and I'm going to ask Chris this question, and it's a two-part question, and then go on to Bowen. Chris, someone asked, what's the most challenging thing for being a professional race car driver with hearing loss? And also, what is your hearing loss exactly? Someone wants just a little bit more information on that, and same with you, Bowen, a little more clarification on your personal situation, if you don't mind sharing. Chris?
Sorry, what's the question?
The question is, what's the hardest part of racing with hearing loss, and also what exactly is your hearing loss, and to define it?
The most hardest part is, for example, if I don't have a better technology, the FM system like phone app, that not able to race car communication with the radio with my spotter to sheep. And my voice, sometimes I get nervous if I'm coming in a race car. And I'm wondering if I'm racing, sometimes if something broke or something's not working, then I'm in big trouble. So that's the hardest part for me. And that's why it's me, Pierre from Bonat, trying to work it out on how to make things better. And the hardest part, sometimes most race series trying to stop me because I'm a hearing impaired. And they said, whoa, we can't hear a radio, we can't race cars. And I said, yes, I can do it. I can show you how this works, it's very frustrating, but you have to keep running and staying part of it and keep pushing, don't give up hope. And but my business is technology, and I'm grateful. And for example, if I don't have this kind of technology, then I can't race cars.
Okay, great, thank you. Thank you. Bowen, did you want to address the question about the type of hearing loss you specifically have? There was someone who asked that question.
Yeah. So I was identified at the age of 2 with a moderate hearing loss. And then it became progressive throughout the years until one day I had a sudden drop of hearing where I heard absolutely nothing. And it was discovered that I had a large vestibular aggregate syndrome. And that's where my journey with the cochlear implant began. So I have a cochlear implant on my left side and a hearing aid on the right side. So I'm what people commonly call as bimodal because I use the two different types of technology. And I refer myself as a hard of hearing person or a person with hearing loss and not hearing impaired because that has a negative connotation with that we're impaired just because we are not able to hear well. And I, the last thing I want to say is like, I would not change anything for the life that I have now because it's really opened up a new doors and new opportunities. And I love the way that it is. And I hope that all of you feel that way too, that hearing loss can be a blessing in different ways when we look at it from a different perspective. So thank you.
Great, thank you, Bowen. Now we have time for, I think, one more question. And again, it's going to be a little bit of a combination of the questions. There's been a lot of talk about changes to business. Businesses have really had to adapt to people coming in or being able to come in with COVID technology. But what can businesses do? They may be in the mood right now if they're going to be at open up and they're changing things anyway. What can they do to better serve the hard of hearing population? Ruth?
I jump in with one suggestion here, Lee, and it's a practical example. When I was dealing with my library, the staff member had a mask on and I couldn't understand her, so I had to ask her to write down what she was saying. A week later, I went back to the same library branch and I identified myself as being hard of hearing to the clerk, and she went to her supervisor who brought out an FM system. So they had a microphone receiver and I was able to hear her perfectly. And it was not just about hearing, it was also about having a human connection. So I think that businesses can do something as simple as that.
Great, thanks, Ruth. That's a really important thing is to remember is to ask, and because there are some businesses that are their libraries may be mandated and small businesses, and we know that there are small businesses who have been affected by the pandemic, and if you're out there and you're a small business or you know of a business who is employing someone who is hard of hearing or is having trouble, let us know through info@chha.ca, and we'll be able to start to respond to that type of request and maybe promote some local businesses who are employing hard of hearing individuals or have hard of hearing technology, people for having technology. Really appreciate everyone's work today, and wanted to let everybody know that you will be getting sent a gift certificate for coffee. We had hoped to have that today, but you're going to get a coffee, and hopefully you can use that gift certificate for our next presentation, the call to action that's happening on Friday. And as Ruth had mentioned, there's also one on Saturday. So Chris, Bowen, Ruth, Marilyn, thank you all very much for what you've done today. It's been enlightening. There's been a lot of chat, and I think you've helped a lot of people out to be able to just understand different perspectives and some of the neat technologies that are out there, and show the world that there's a great exploration, whether you're in education, the medical field, or you're a race car driver. All wonderful things that anybody can do. So thank you very much.